Today, we're going to be talking about devolution, data, and levelling up. Can the devolution of data support the country in the recovery of and in the future? I hope the answer is yes. The pandemic has obviously underlined the importance for policymakers of using data and analysis effectively to help them make decisions in the crisis. But it's also at the same time, I think, exposed the lack of good data that is available to support local leaders to make those decisions. And I think in some instances, the lack of analytical capacity to use the data that they do have effectively. So what role should data play in effective policy making? A lot, I would hope. How can central and local government work together more effectively to ensure that they have the information they need to make the informed decisions they need to make? And if there is a local capacity deficit, how can we address it? So these are some of the issues and questions my esteemed panel are going to address very shortly. But as always, let me just say a few words of housekeeping before we begin. So as always, the event is being recorded and then will be made available along with on our website after the event. During the event, please keep your microphones on mute. If you want to tweet about the event, the hashtag is DevoData. There'll be opportunities for questions to the panel after they've made their opening remarks. You can submit your questions at any time to the panel. You don't have to wait until we've heard from all three. And you do this by sending your question via the chat function to ask a question. When we get to the questions, which will be in about 20 or so minutes time, we like you to ask your questions, so be prepared. But if you prefer me to read out your question when you submit it, just say so and I will do that for you. And we'll be done by 12 o'clock, no later. So let's get going. Let me introduce our brilliant panel. Our first panelist is Arpana Verma. Arpana is Clinical Professor of Public Health and Epidemiology at the University of Manchester, Director of Manchester Urban Collaboration on Health, and an Honorary Consultant in Public Health at Public Health England. My second panelist is Rebecca Riley. Rebecca wears several hats, including Head of Research and at the Office of Data Analytics at the West Midlands Combined Authority. She's also Director at City-REDI and is also a chair of the newly established Green Book User Panel. And our third panelist is Tom Forth. Tom also wears several hats, including Head of Data at the Open Data Institute Leeds, and he's the founder and director of a data consultancy called I Am Activate, as well as doing lots of extra work in and around this space. Each of them will speak for a few minutes, setting out their initial views on the various issues, and then we'll get into questions and from you, and they get them to answer those. So, Arpana, over to you.
Thank you, Andrew, and thank you for this opportunity to talk to you today. And it's so great to see so many of you involved in this discussion. So we've been part of the Manchester Urban Institute and Policy at Manchester, really for raising the initiative around urban health and the research at city level, which is really the important component at the moment for the levelling up agenda. And within Greater Manchester, obviously with the devolution agenda, I think it's one of the key things that we need to think about is the way that we collect, utilise and then disseminate information that's usable for the people that need to use it. And so in terms of some of the lessons learned, I think coronavirus has really given us the opportunity in a way that I couldn't have predicted previously to work together across not just locally but nationally and internationally with the vast amounts of evidence and trying to put that into practice. One of the key things was the control of patient information, the COPI notices that came out quite early on, and that certainly allowed us here in Greater Manchester to look at speeding up our integrated digital care record. And it's something that we're very proud of. and something that really highlights how coming together is so important. I think the next step for that is how we now implement the usage of this resource. And this is where, for the Levelling Up agenda, I really wanted to state the case for two things, and that's of this local leadership for data and information. And then the second thing is our call to arms for small to medium data, as I like to call it. And there's so much on big data and how we'll be able to solve all of the solutions of the intractable problems that we're seeing in health and social care with big data. But I'd like to make the case for how we actually need to do the opposite and the importance of that local knowledge. So in our research, whether it's included both the communicable diseases like coronavirus or bloodborne viruses, or things to do with inequalities, what we've really found across the board is the importance of that local leadership. And that's public health, including our fabulous directors and our local Public Health England leads, but more importantly, our councillors and the way that the councillors have a lot of influence and being able to really connect up the data in terms of information that can help them has been the most important one of our findings. And it didn't matter if we were looking at Greater Manchester or parts of Vietnam and the rest of Europe. It was something that we found across the board. And we certainly know from looking at data that's available, thinking about having those data sets that are timely. So nothing like the old-fashioned way of doing, say, something like an evaluation report that comes out maybe 1 or 2 years after the actual intervention's finished, and thinking about really iterative approaches to getting the data to people who need to use it. And within that, I'm also including local leaders, whether they're community leaders from the faith sector or community leaders that are the navigators that we find in all communities. It certainly is one of the most important components going forwards. So our call to arms was really based around the fact that national data often will mask what's happening within our cities. And then in our cities, the data that we often collect will mask what's happening at neighbourhood level. And so what we tried to do was drill down as to why things were so different when you were extrapolating data from national surveys into very small area statistics. And it could be something along the lines of the fact that our census is now 9 years old. We're going to be getting a refresh probably next year. And then we've also got the boundaries. So the things that actually are determining how our data is presented, either in maps or tables, often at either ward level or super output area level. But this doesn't then actually communicate with neighbourhoods or communities. And so being able to think about these different issues is what we've been doing with the Manchester Urban Institute and policies at Manchester to try to get the message out. And certainly my time working in a public health department, our fabulous Director of Public Health, Dr. Peter Elton, always believed in that local knowledge on which to base our health and social care and well-being survey on. And this was something that he invested in because of the intelligence that far outweighed what we were getting from looking at national data sets. So really, I'd like to conclude by saying that it's so important to get these data right and to have meaningful, timely data that's presented in a way that's useful for the audience that needs to receive that data. And what's key is our communities, so the leaders and also our neighbourhoods that really are very different with very differing needs, and to be able to work with our local teams to be able to do that is part of not just the preparation for pandemics and epidemics, but also all the things that we've had to put on hold, from cancer prevention, obesity prevention, and our chronic disease management that we've been talking about before the pandemic hit. So very pleased to take questions at the end, and thank you very much for this opportunity.
Brilliant. Thank you very much indeed, Arpana. Before I go to Beck and get her views from the West Mids, you mentioned the COPI notice. Arpana, just say what that is for those that are uninitiated in that space. Well, firstly, what does the acronym stand for? And then just very briefly what it is.
So it's the control of patient information, and it allowed us, for the sake of dealing with the pandemic, to think about how we can connect data sets so that we could get an integrated care record that linked up health and social care.
Brilliant. Thank you very much indeed. And something that you've long wanted to do, and indeed this applies across policy fields, which we'll come back to. It took a pandemic almost to make, you know, real progress in rapid time on that. So maybe there's something in there that we want to explore when we get into Q&A. Becca, give us a view from the West Midlands. What's happening in your patch, Beck?
Hi, I suppose what's interesting, just picking up on some of the points made before, actually, is how important it is to understand why we're interested in the data, what decisions the data will affect, and who makes those decisions. And I think that's the principle that we've sort of set out really, and also what's the decision-making structure that data needs to feed into, and therefore how does it influence those decisions. So I think one of the problems that we face in terms of devolution is different places have different powers, different structures, and although we're all interested in sort of similar issues, we may not have the power to act. So you end up with a process where actually the data ask is driven by the power to act, not necessarily what the place needs. And this affects what data is required, what's specified, and what's commissioned and used. But actually, you know, places need really good data across the board, and that's why we've instigated a process of doing we do a State of the Region report, which basically starts from the premise of the Sustainable Development Goals, looking at what we can understand across the board, regardless of which different organisation has the ability to act, which then sets out some key priorities. But there is a difference then between that strategic data, which allows comparison and benchmarking, to the information that we've just heard about, which is more about delivery level data that allows improvement in service provision, and the two rarely meet. And actually, they don't often feed into one another. So I mean, and that I think is one of the goals that we're striving for in the West Midlands, is to bring those the practical delivery data together with that high level strategic data that allows us to make case making and do the benchmarking. What we've implemented then is a process which I think I regret to this day, because we're on week 45 of weekly monitors, and it makes my Wednesdays horrific. But we do implement our weekly monitor, which the purpose of it was to feed into the Mayor's Economic Impact Group, which sits every Thursday. And that brings together data and intelligence from across the region or internationally. And it tries to bring together also the qualitative data, because what we've found in the last 12 months is that actually most of the data stream is lagging. Even real-time data is lagging. So we've done a lot more to try and capture the qualitative information from business representative organisations, etc., who are dealing with businesses and so on a day-to-day basis. And what we've sort of discovered is that gives you an indicator of what will happen in the data. And most recently, I suppose, is the latest PMI that's just come out has dropped back into negative, and we're in contraction again. But for the last sort of 3 or 4 weeks, we've been hearing that definitely from organisations. So it prepares you and it helps you do that. I suppose my big asks really around this is around the devolution of data. Fundamentally means investment in data at all levels. In infrastructure, in analysis, and most importantly, the application of data. So being able to use that and making it relevant, and that's where the sort of the business case development comes in, because ultimately all this data is about making a business case for investment and change. So for instance, as an example, this week, because the workforce jobs we've been looking at, and one of the issues there is that the sample sizes aren't big enough to do really detailed qualitative analysis at the local level. So we end up in a strange situation where we have a spike in loss of jobs in health. And when we unpick the methodology and we unpick what happens behind that, actually it could all just be down to the confidence levels on the data. And that is an expert capacity needed to be able to apply to it. And actually people could make decisions on that and it could be wrong. And the other big ask is following on from that is investment in skills and capacity. I think what we found in the last sort of 10, 12 years is that the public sector has reduced its capacity in these areas specifically, and the private sector has accelerated. And some areas which have continued the investment, and in the West Midlands examples would be actually Public Health England have maintained their capacity. The police have accelerated their capacity, and they're leaving other organisations behind. So we're now competing for skilled staff, we're competing with the private sector, we're competing with each other. But without that capacity, you can't put good business cases together and you can't win money. And in a competitive in funding environment, then it's not drawn into places, and it doesn't aid in levelling up. And I think the Green Book review and the new Green Book that was launched last year exposed this capacity. And I think that process and that the skills structure within that needs to be invested at all levels in order that places can actually compete fairly for funding.
Brilliant. Thank you very much, Beck. I mean, again, highlighting there, making the data available. Well, data availability is a question. I know Tom's going to touch on that. And then there's a question about what it is that data is going to be used for, and the degree to which we understand its limitations, as well as, you know, what it can or can't be used for. And then the really interesting questions about the capacity more generally to use whatever data is available as well, which again we can come back to. We've had a couple of questions in on that already. Tom, give us your view on on these sorts of issues around availability and how governments of different persuasions work together.
Certainly, and I'm happy to start with some positive news for us all. I mean, the UK is genuinely, we talk about being a world leader at everything. We are genuinely, the UK national government and its national institutions, especially the ONS, are world leading at data and digital government. Unfortunately for the title of this day, we are world trailing at decentralizing power. So if we want to use the brilliant national data that we have to achieve some kind of decentralization of power, and I think thus levelling up, I don't think we're going to get levelling up without local decisions being made, since so often the national decisions are poor. Then we probably have to find a middle ground between excellent national data and not much decentralized power. And exactly as Rebecca was saying, one of the real challenges with having lots of excellent national data increasingly is that after decades of cuts, there is not the capacity in local authorities to analyse that data, either to understand what's going on the ground in all areas. And I should say it's in all areas. Every local authority has some areas where they are excellent, but I think no local authority could honestly say it's excellent across all areas at analysing the data. And that is just a question of scale. And that's why I'm so convinced that operating at the scale that both of the previous speakers do, which is at either a Greater Manchester or some similar type scale or a West Midlands scale, is probably the way that we achieve the scale that we need to make better decisions using data, but also to analyse what kind of things are going on with data. I mean, just to give us a very specific example of some work that we did at the Open Data Institute Leeds, we worked with Transport for the West Midlands about 4 years ago to start tracking every single bus in Birmingham, Coventry and Wolverhampton. And it was a fantastic project. The out of that project is still used by traffic teams across the region to find out when a sewer's burst and there's a tailback on a certain road, that they're out there within 20 to 30 minutes quicker because they can see that the buses have stopped. And that's the first that's the first thing that gets to them and fixes the problem. Now, that was a fantastic project which was led by the West Midlands Combined Authority and Transport for the West Midlands, and it moved the West Midlands well ahead of what was capable nationally. So nowhere else in the country was able to do it. So this innovation, which was powered by data, was led in the West Midlands and provided to them a real advantage. The challenge that we had was that immediately when we published the work, we got people from national government and national bodies asking us, could we do it for the whole of the UK? And the answer was no. We can't do it for the whole of the UK because it's the West Midlands who's paid for it and has spent 2 or 3 years before we even got involved in the project, putting in place the infrastructure to track every bus. Now, at the start of this year, that same infrastructure was put in nationally, but it's 4 or 5 years of delay. So I think when we're talking about using data in this way to power levelling up, we have a problem because the West Midlands knew where it needed to put in bus lanes and it knew where it needed to improve its transport strategy. And that didn't really matter all that much since it had to go back to central government in Westminster and ask for the money. And since they didn't have the data there, they couldn't say yes. So we risk this problem where if we allow individual places to move ahead with data, which I think we must, we also need to allow them the power to take action based on that data, because the centre is just not going to be able to catch up with the best examples. And of course, there's probably an example that most of us know very well, which is Transport for London, which is kind of the exception that proves the rule. Transport for London is probably the world's leading local transport agency when it comes to data. They've done some brilliant things, from all of the analysis they do of Oyster card use to tracking people on Bluetooth and Wi-Fi on the tube and figuring out where they actually change. They've largely been allowed to go it alone. They largely have been allowed up till now to take their own decisions, and largely self-funded in many ways. And the quality that we get there is just brilliant. So I think one of the challenges we will have with mashing together data and devolution and levelling up is this national desire to avoid postcode lotteries and to hold back the winners so that nobody can get ahead. And I think it's worth saying, Transport for London does better. The other places don't do worse. The rest of us are all stuck at the national level. That's the floor of performance. Very few places are doing worse than that. It's just that some places will pick certain areas to get ahead. And obviously, as a resident of Greater Manchester, I hope that Greater Manchester gets ahead slightly on health, because it doesn't hurt anyone for us to do even better, right? And very quickly things filter out. So I think in terms of data, devolution and levelling up, that's probably the main point that I'd want to make, is that we have an excellent national infrastructure for doing data and digital on which to build, but we have to allow local areas to move faster. I don't think they can move faster at local authority scale generally because it's too small. So they need to work together, whether that's West Yorkshire scale, West Midlands scale, Greater Manchester scale. And then once they do move ahead, they need to be listened to by central government, even if central government is behind. And it will take some honesty, I think, in central government to admit that they're behind. And just to end on 2 examples of that, Greater Manchester invested a lot of money in its industrial strategy. There's a huge amount of data analysis and a lot of ideas in there, but ultimately what was required, and it was the same for all parts of England and possibly some devolved places, the devolved nations took care of some parts of the industrial strategy work themselves, so it's a bit different there. But for all parts of England, they did all of this work to figure out what they needed to do. A lot of it was really good data analysis, but then they had to send it to HQ for them to be read over and have decisions taken about them. And it makes it a bit harder to do things. The last thing I'll say then is on bins, which is, anyone who knows me knows it's my favourite topic. I write an app that tells people when to put their bins out in Leeds. It's hugely popular. When the pandemic hit, the first thing that people said was, we're going to have to close the tips. We can't keep them open. Could you start telling people in their app that they need to book an appointment to go and visit the tips? This is a data and digital government challenge. It's a service that requires data and digital to deliver. A few weeks after this fantastic service had been rolled out by Leeds City Council, every council in England got a letter telling them not to restrict access to the tip. And this was an example of how local government really can move very quickly using digital and data. But if it's always being watched and held back by central government, we're not going to have the kind of improvements that we need to use data to achieve levelling up.
Brilliant. Thank you very much indeed, Tom and Beck and Arpana for their opening comments. There's so much in there to explore, and we've had some great questions. I mean, immediately kind of thinking around whether the principles that underpin COPI, Arpana, whether they're applicable to other domains outside of patients and health. My gut feeling is yes, but I'd be interested to get your thoughts on that. All of you have touched on, capacity and how we deal with that at the varying levels. And then I'm also interested in issues that you've again all touched on, but you finished on these sorts of issues, Tom, which is about the hierarchy of data and therefore how it's then used to make actual decisions rather than just provide some interesting analysis that we all like to look at as well. So I think there's loads of kind of issues in that. But Arpana, maybe start with you on that the COPI point, and whether there are principle there, the underpinning principle of better sharing is applicable to other domains, or is there something unique in the health sort of sector that constrains it? Because health has always been at the kind of forefront of data and analysis and evaluation and trials and all those kind of things. But just what's your thought on that?
Thank you, Andrew. Yeah, great question, because it's really great to see the amount that's happening through a number of initiatives, not just COPI, as you mentioned, but for example, looking at how we harmonise data sets. And like you mentioned, health has got wider determinants. So it can't just be about what's in your health record. The things that are probably going to have the most benefit to populations are actually the wider and the social determinants of health. And I think through the efforts of a number of organisations, that's really on the agenda at the moment in terms of the issues that we're seeing during the pandemic that really have highlighted these inequalities. And it can be inequalities around the geographies and the way that we're seeing the pandemic and the new variants spread, all the way down to the risk factors. I think there's a strong validation that the reasons why we might be seeing, say, worsening death rates in some groups is because we are actually able to measure things like deprivation, employment, ethnicity, to try to get some of those key messages across in terms of how we now tackle the pandemic. And so the efforts of different organisations, from NHS Digital to HDR UK, and also the work that's being done locally as well as nationally, is really vital. And just to really plug some of the work that's going on internationally, where we've been trying to increase the output by harmonising indicators across the main places where we have to report, is just so vital, so that we can get that benchmarking and the comparators that Rebecca was talking about, but then also think about how we have that at local level.
Yeah, no, brilliant. Beck, your thoughts on, in a sense, as the, as health and the, the coping notices, is there something there that is applicable to other domains? We know, for example, we had a couple of questions on this, that we would ideally want to be tracking individuals through the labour market. We want to understand people coming off welfare and into work. We know that those data sets exist in silos, but we have real problems, linking them up, and there's a resistance at central government and particular departments to allowing us to do that. I mean, that's a similar set of challenges that the health sort of sector faces. They've overcome it. Can we overcome it? I mean, what's your thoughts on that?
Well, I'll give you a very practical and very real example at the moment. So in the West Midlands, we have a slightly unique structure which is the reason for me having multiple hats, in that we have a collaboration between the universities and the public sector organisations within WM-REDI, and we're putting in place collaboration agreements and data sharing agreements. And it allows us to use the might of the universities in terms of the intellectual activity and bring it into these arenas. And what we've got one particular project where we've been addressing that skills pathway project, and we've done some initial work using ILR records and the AEB sort of data to be able to understand those pathways and where people fall out. We now want to link it to national data sources, and we're in this strange situation where if I use somebody within the university, we can access the data through the UK Data Service. However, the combined authority staff, who are actually the people working on this project, can't do that because we can't create the infrastructure to be able to access this data. So we have real problems with the public sector organisations being able to access the really good ONS data that Tom's just mentioned, actually. Yet if you were in a central government department, you'd have an analyst who'd be able to do it. So we have the way the central government treats organisations out in the regions is very different to how they treat their own departments, which has a knock-on effect to the data. So I think we do have some real constraints about how organisations like combined authorities, which, I agree with Tom in terms of bringing capacity together, can actually access this data and can actually use it and can actually apply it. And you have to be pretty creative at a local level to ensure that you can get the right people to access the right data and then share it in the appropriate way. And it is really convoluted.
Yeah. Tom, you've thought about, we've talked a lot on many occasions about this and some of the reasons why it doesn't work as smoothly as we would ideally like it to. And there's a mix of factors in there, technical, political, I would say. Just your thoughts on that, and then I'll come. So just to let you know, Jack Bradley, I'm going to come to you, and you can ask your question on capacity in a second. But Tom, just have your thoughts on these questions.
Yeah, so I think it's really important that the big steps forward we've made, and Arpana's example is obviously the best one on patient sharing, but everybody, if you just ask them, so that, is it okay for us to have all of your information about your health in one place? Everybody says yes. So there wasn't really a huge public pushback against this happening. It was just something that we needed a sense of urgency to achieve. I think that we should be aware that it will take years of really hard work by a lot of people to kind of make permanent what has happened in a rush over the last 9 months. But I think everyone's ready for that. There's even other little things like for about 10 years, every bus company in the UK has said it can't share whether the pushchair seat's free or not. And every parent who wants to take the kid on the bus has been furious about it. About 3 weeks into a pandemic, suddenly they can tell you whether the pushchair seat's free. So obviously we need to make sure that all of the excuses that we had in the past get a good hard look at them and say, no, it's not commercially sensitive to tell someone, whether they can get a wheelchair or a pushchair onto a bus. Come on, let's keep sharing it. I think there's a second part of it, which is, for example, the Treasury started giving out lots of loans. It started allowing people to be put on furlough. It had that data from day one. The data was not acceptably good until about October. So for about 6 months, people like Rebecca doing economic development policy in all of the parts of England were flying blind. Actually, this is all of the parts of the UK. So the HMRC were not even sharing it with Scotland, Northern Ireland or Wales. So we had 6 months where the central government knew exactly where people were furloughed, and it knew exactly what sectors they were in, and it knew exactly which ones would require support from local government, and it just wouldn't share the data. And it wasn't, it was a cultural and a political thing more than anything else. They wanted to retain control over that. I saw another example of it. So it's not just central government. It's the Bank of England, for example, were tracking how much people were spending on their cards to understand how people were doing, how the high street was doing, how shops were doing, where money was being shifted to online or whether it was being saved. They had a graph of it up at every single meeting they did for about, they had it from pretty much day one. I think it's only about 2 weeks ago that they finally let you download that. So it's nearly a year that these places hold on to it. And I think that for the most part, it is just holding on to power. And data ultimately is a part of power. If only you know what's going on, you get the biggest say in what's going to happen. So that kind of cultural change, I think that now we've seen what's possible. I don't think we'll get the cat back in the bag. I think it's out. We just need to fix it all.
Arpana, just, I mean, again, you know, as you all sort of feel, has it got something to tell us about, you know, those issues about how we unlock, how we convince the powers that be that have all the information not to hoard it, but to share it? I mean, what's been your experience in the health, in the health sector around that sort of, that kind of issue?
I think there's one of the key quick wins is the language that we might be using. So it's so easy to go into jargon, and especially when you're trying to explain something like data linkage or why a national estimate might not be useful. And so I suppose it's that building of a relationship with the key people, so the users of the information that you're trying to disseminate is just so crucial. And not to underestimate the participatory nature of how you do that dissemination. I think the key skills for knowledge transfer is often, it's not inherent. We've got to train people. And so capacity building so that we've got a set of skilled people that can do that knowledge transfer just is really important. And for us to recognise that it's not just there. It's something that we need to really develop and think about as we go forwards.
Yeah, no, that's a great point. Touches nicely on, links nicely to Jack Bradley. If you're still on the call, Jack, can you unmute and ask your question, which is about capacity and skills at the local level? Jack, are you there?
Yeah. Hi guys, that's been really, really interesting. I'm sort of asking this for my mum because she works in Essex and local government, and this is quite a bugbear for her. I work in central government, I'm afraid. So don't
apologise as long as you're doing the right thing, Jack.
Yeah, well, I'm really interested. So I think from whenever I talk to her, she's really interested in all this stuff, but she sees a real dearth of data skills, and she knows she could do her job much better if they had much better access to data science and computer science skills. This was initially for Arpana, but it's for any of you. Do you have proposals for how to improve the data or computer science skills for local government and community leaders? And do we need to train them or bring those of these knowledge like you guys to them?
Yeah, that's a great question, Jack. And it's particularly that last bit, because in a sense, Beck, you were hinting at, there are different models that we should think, some is you buy it in and you get it from outside and then it goes away again. And there may be some good things about that, but not so good things about that. Or do we try to build the internal capacity over time? That's probably going to be take slightly longer, maybe more challenging, and all the rest of it. So Beck, you start us off on that. It's you know, the capacity, and then how do we get it, and do we get it from without and bring it in, or do we build it up?
I mean, I think the first issue with that is the decision makers about who invest in people and invest in training understand the importance of it. And I think the approach that sort of I'm trying to take anyway in the region is to start with the you know, the might that is the Green Book, and that's getting everybody to understand how important creating a business case for intervention is, and how much evidence and research is vital to doing that. Gets decision makers on board with that idea, and then the process then is, I mean, we've took an approach of building collaboration with the capacity that we have within the universities, and trying to bring those together. It's not a replacement for the analytical skills in the local authorities and in the structures like a combined authority, and we do need to still invest in them, but you have to demonstrate to those people that will invest that it's an important thing to do, and that's, you know, that's what I'm trying to champion, I think, and we all need to champion, really.
And is there a scale issue there? I mean, Tom talked about, you know, you have to have an institutional scale to make the investment worthwhile on the up, you know, on the input side, but also then you need to be able to deploy it at a sufficient scale to make use of those kind of those skills if you do that. I mean, is there something in that space?
There definitely is, and I think the other thing is that sort of idea around knowledge transfer, actually, that was mentioned. It's not an inherent skill. You know, we have to be taught to do that, and a big element of data science is it's as much about how you present that data and what story it tells as the actual analytical capability that goes underneath it.
Yeah.
And I think that's quite important. I mean, I'm slightly weird in the fact that I have a fine art degree and I've got a social sciences degree, so I bring those two things together. But I'm unusual, and I think that's the good signs, you know, that we've seen in central government. Is moving much more towards storytelling, and we need to get better at that at the local level.
Yeah, no, very good. Tom, you know, your thought on this, you
Yeah.
know, buying in, building up, and then
Yes, I think three things I'd say. The first one is be collaborative. So at ODI Leeds, we run an open data working group. About 15 councils once a month come and share how they're working with data, and basically they leave copying 14 other councils on a certain thing, and that's absolutely brilliant. And I know that there's similar things right across the country. I think the second thing is to be open. All of the work that we did on buses in the West Midlands is released openly for anyone else to reuse. Sheffield City Region reused it for their bus commission work. They didn't have to ask permission, they didn't have to pay anything, they just got it done. And being open really does help with all that. There is a slight fear in local government about being open, sadly, because they are in an artificial competition with each other, because the money is decided centrally. So if you're in competition with someone else, it is quite hard to make a business case for being open. Yeah. But I think most people win most of the time. And then the third one is what you said, scale. A local authority, a district council at 60,000 people is not going to find it really hard to create a digital and data team that can do any useful analysis of all of the sectors that they work in. Yeah. You want to be operating at something that's closer to 1, 2, 3 million scale. You know, you could scale that up forever. You could say that everything should be done nationally by the UK government at 55 million people scale for the whole of England. Well, the problem with that is that that's too big. And then you can't even talk to the person. They end up answering the wrong problems, and we end up with very strange things where, for example, you start talking about a single bin collection standard, as if Cornwall has the same bin collection problems as a block of flats in Birmingham. He said, let's not do that. So you've got to get your scale right. So it's a collaboration, open, and scale are my three answers.
Brilliant. Thank you very much, Tom. Arpana, again, you know, interesting, again, we've had some questions about, you know, in the public health space, how has one gone, well, what's the general state of capacity? And then, you know, how have you gone about improving it and building it and supporting it? Is it inside out, or from the inside
So in terms of capacity building, we've had an initiative that's been funded internally by the university to link up public health, data science and health and social care. That's really been influential in getting us the resource that we needed to create completely free open access materials. Because I think when we're looking at capacity building in something that is as complex as a local authority working within a conurbation or a different geographical level, it's not one size fits all. And so really being able to segment and understand needs is absolutely fundamental. And so what we're bringing to the table is that whole population approach and the evidence base, because as we know, there's the use and abuse of indicators and data, because you can make it go whichever way you want in terms of the policy decisions that might come off it, and some of the issues around evaluation and real-time evaluation of real life interventions, not a randomized control trial that's so controlled that you actually don't see what the translation of it is in real life. So I think a lot of the work that we're doing really is going back to public health 1.0. Taking it right back to where we started in terms of having local data with that local leadership determining needs rather than demands, because it's so easy to base policy on what you can collect rather than on what you should be collecting. And then having that feedback loop, and it's a constant cycle of activity so that we can basically check that we've got it right. And I think one of the key things we found is for every intervention, for every action, there's those intended consequences that hopefully are positive, but you also get a range of unintended consequences. They can be positive, but sometimes they are negative. So thinking about failing fast in being able to utilise this cycle of intervention is one of the key things that we're trying to implement across a lot of our evaluations.
Yeah, no, that is a great point. We've had several questions on this. One, Francesca Gaines asked this question. She asked me to sort of pause it, but it's been touched on by other people. And Francesca's in typical it's very simple, but it reveals a lot, which is what gets in the way of getting the right data at the right level. I mean, it's a simple question, difficult to answer, but it touches on this issue about, I think you referenced it, Tom, and you did, Beck, which is about, we know that data exists because we can see it at the national level. We know it's collected, and it would be, it would be feasible to have that at different geographies, but it's not made available for whatever reason. How do we overcome that? What is it that, other than imploring them or relying on the enlightened individual, the champion, which is the kind of classic way, are there underlying incentives or structures that need to change to make that sharing of data more appropriate, more possible? Tom?
Well, I think it's two ways to go. The one which I unhelpfully and sometimes unpleasantly go about is from the bottom up, right? So if you take an example of tracking all the buses in Birmingham, we just said we're going to do it, right? It's just got going. And there's a fantastic company which I worked with when they were starting out. It's brilliant, Teacher Tap. They survey 10,000 teachers every day. And the reason for it is that Becky and Laura, who run it, were tired of having to get data from the DFE. They thought, well, I'll just have it myself. And I think there's actually quite a lot of good examples of places going out, getting started and collecting data themselves for what they need. Probably equally useful, perhaps more useful if I'm honest, is there isn't really a principled pushback against central government and national bodies making data available at better scales. And perhaps the best example we've got of that is the Office for National Statistics. I don't think they would deny that 5 years ago, their local data was shocking. It was so far behind what the rest of Europe was enjoying that it was really embarrassing. Today, you would have to say that it's right up there with the best in Europe and always getting better. So there's a chance to work from both directions at once. And I think that most people are actually really positive about doing that. Most people in most departments are really positive about doing it, especially in the bodies that are outside of government.
Yeah.
Some do need a kick, but we can keep on kicking them, I hope.
That's a great point. And Beck, I mean, supposed to be, is the fact that, the combined authorities exist, that we now have metro mayors, is that, in this sense, and they demand of government certain things, is that one of the ways that you can envisage, national government and national agencies being more responsive to these kind of constituents because the demand is there?
I mean, I would echo what Tom's just said, actually, in the sense of, I think ONS have done an awful lot of work, especially with the combined authorities and trying to work to build out the data, etc. I think there is demand from mayors, but it comes back to that scale issue of, what's the right level to make those demands, and what demands are you making on what type of activity. And I think there is, if I think back to sort of 20 years ago when I was first starting doing these sorts of things, actually the data in a lot of circumstances was a lot better, because there was a lot of investment in national surveys and data that you could disaggregate much better. So we've had a number of things happening, and for me, ONS do a very, very good job, but with one hand tied behind their back. And it's the same, in a lot of government analytical roles as well. Is with the Green Book, the biggest driver might actually be the fact that now you have to do a place-based assessment. So this will mean that central government, not just local authorities, etc., have to look at place impacts. Therefore, there will need to be some data. So they're going to have to invest in something to be able to meet that criteria.
Yeah, and that goes beyond the reliance on the enlightened individual.
It does,
right?
yeah.
Only gets us so far. Arpana, your thoughts on that, and particularly the sort of structures and incentives that would encourage more data sharing or more data availability.
Yeah, just to second what both Rebecca and Tom have said, I think the issues to do with how we look at the barriers that are preventing us from linkage, we can look to our European and other partners. And I suppose one of the key things would be if we could give back some of that ability for the local director of public health to be able to perhaps have more control over the survey questions that they could then adapt, but they're getting their local data back immediately, not waiting for the delays in terms of getting national data sets being analysed, and having that localised, very specific knowledge of what their communities are, both geographically and their needs. And again, coming away from all of this demand-based commissioning that we often have to do, because those are the only data that we have. Going back to Public Health 1.0, where it is based on the health needs. And by those needs, I mean the wider determinants that have such an impact, and being able to really focus in on those components so that you can make strategic needs assessments the cornerstone of a local authority's strategic plan. So that whole health in all policies would just be so phenomenal. And I think we'd start to see a reduction in inequalities that sadly, despite the advances that we're seeing in both health and interventions associated with health, we're not seeing that being distributed fairly across either within our cities or between our cities, and being able to really focus in on that levelling up agenda is just so important now more than ever.
Yeah, no, yeah, that's a great point. We've got a few minutes left. I want to touch on another issue. It's been raised by several, and Charlotte and Susan raised this. Susan asked me to put it to you, really, and it was something that we touched on earlier on, which is this issue about the relationship between, and she got both of these in inverted commas, official and non-official data, and how decision makers regard it or should regard it. You both, particularly you, Beck, and Tom, you talked about data that is classed non-official, and then there's obviously official stuff. I mean, how do we manage that? I mean, how do we advise our decision makers to take regard of good data or bad data, and the sort of the limitations that come with it? Her question was much better than what I've just put it, but I've tried to mash them both together. So Beck, you start. Official, non-official, hierarchy. How should decision makers respond?
First, I have to apologise for my dog's barking in the background. But I think I always go with the approach that use both, because they fit for purpose for different purposes. The official data allows you to compare and benchmark.
Yeah.
And that's often what you need for in some circumstances. The unofficial data, which can be a wide variety of sources, can help you explain a particular issue, and they can help you unpick it, especially at a local level where you might not have the data. So I think really it's got to be a balance between both, and not to forget, this isn't just about numbers. This is about qualitative information, and that is data as well.
Yeah.
And wrapping it up, it's just different purposes, isn't it, really?
Yeah, no, quite. Tom, your thoughts on this
Well,
sort of issue? You talked about DFT being not convinced by non-official local data. I mean, and they've got their official stuff. How do we deal with that?
Yeah, I've had some bad experience with official data, and obviously the dreadful one that happened was when the Department for Transport put Essex in the Midlands, just so it could score a point against the north of England to say that transport investment had been higher. It says, oh, transport investment's been higher in the north than the south. I said, well, is Essex in the south? No, it's in the Midlands. Well, there you go. So I think that there's a risk in saying that someone has the sole authority to say something's official. What we do have in the UK is something really quite good, which is we do have an independent statistical regulator. They will come in, and it may take a few months for them, but eventually, if someone does start getting silly with data, they do get told off, and that's something I think we should be quite proud of. If you mess up, you can do it, but 3 months later, the statistics authority is going to come at you. So I think that's quite good.
Yeah, no, quite. That's a good point. Arpana, final thought from you on this. The relationship between official and non-official data.
So one of the pieces of work that we did, because we had our local survey, was compare it to national estimates. And so because we were able to get a decent sample size, our confidence interval, so how confident we are that the number that we get at the end is actually truthful, was much smaller than the national estimates, but sadly very different. And it didn't matter if we looked at smoking prevalence or the actual incidence of different diseases, but it's how you then utilise those data comparators to be able to influence change. And that's why it's so vital to have the local DPH who can actually analyse and think about the evidence in that context to make the difference. But the other bit of unofficial data was all of us will often hear something social media or from friends and family, and we'll all put a very different value judgment onto that piece of evidence or something that somebody from university or from somewhere else might say. so it's just to be absolutely aware that everyone that we're talking to has also got those influences. And so really getting that relationship so you can understand where those influences are coming from, I think is vital for the unofficial data that people might be using for evidence-based decisions.
Brilliant. Thank you very much indeed. A great thing to finish on. We could definitely go on. We've had loads and loads of questions. I apologize, we only got through a small number of them, but it is 12 o'clock, so we need to finish. My thanks to our brilliant panel, Arpana, Rebecca and Tom. Thank you very much, all three of you, for giving up your time this morning. Thanks, my continued thanks to Policy at Manchester for working with us on this series of devolution related events. You can find recordings and all the associated material from all the previous events that we've done in this series on our website, centreforcities.org. Thank you all for joining, asking your questions. Apologies again. I know several of you asked more than one, and I didn't ask any of them. I apologize for that. Don't take it personally. Just blame me for being a kind of rubbish chair. I'm happy to accept that. Our next event is on the 23rd of February, and it's on one of my favorite subjects. So if Tom's favorite subject is bins, mine also begins with a B. It's one of his favorite as well. It's on buses, and it's about buses and the future of urban transport. It's going to take place on the 23rd of February. So if you're into buses, then come along and see what we've got to talk about then. Hopefully see you all then, but until the next time, take care and stay safe. Thank you very much indeed.